Hey everyone, if you're pregnant and planning on traveling sometime soon, stick around. I'm going to discuss some issues about that today. Dr. Wes Davis. I make weekly YouTube videos discussing some of the best evidence-based information to help you have the best possible outcome for you and your baby. So if you're new here, please consider subscribing. Very commonly when you're pregnant, you plan on taking a trip somewhere. Maybe it's Disney World, Hawaii, Mexico. Maybe you're even thinking about Europe. And I get questions a lot about concerns regarding travel in general, airline travel, things like that. So I thought I'd take a few minutes today and talk to you about some of the most important points that relate to that question. How far along is it okay to fly? Turns out most airlines will let you fly up to 37 weeks. I think that's pushing it. I wouldn't fly across the country after about 34, 35 weeks unless it was just an emergency and you had to go. You never know. Your water could break, you could go into labor, you could have some complication, and if you're over halfway across the country, you're going to be stuck there. So keep that in mind. But if otherwise healthy pregnancy, 34, 35 weeks is fine. I think 37 is pushing it. But if you had a family emergency and had to travel, just make your best judgment. One of the big concerns about airline travel, especially long haul flights, is the potential for blood clots or venous thrombosis, particularly in your legs. If you're sitting cramped up in this airline seat, because you know they're making them smaller and smaller, it seems, and less space, and you're pregnant, you have a higher risk of blood clots. One of the best things you can do, get up and move around in the cabin, go to the bathroom, walk around, stretch your legs frequently, like at least every couple of hours. Also, staying hydrated is really important. The tendency to become dehydrated on airline travel is pretty typical. You don't have, the air is not as humid, and you're breathing probably more rapidly because you're flying at altitude. You are more prone to getting a little bit dehydrated. So drinking lots of water will help prevent dehydration, which also reduces the chance of blood clot. Another thing you can do to potentially reduce your risk of blood clot is to wear support stockings while you're in flight. They tend to cause compression in the lower part of the legs and improve blood flow back to your core, and that reduces the risk of venous stasis, which is one of the things that's required for a blood clot, is for the blood to kind of pool in your extremities. If you are flying at altitude, obviously airplanes fly 30, 40,000 feet in the air. They pressurize the cabin to somewhere between 5,000 and 8,000 feet. And that's safe for pregnancy really at any point. However, you may notice a little mild shortness of breath, but it's not anything dangerous, and it's not dangerous for the baby. The other thing that I always tell everybody is it's a good idea to assess your risk for things like preterm birth, high blood pressure, other complications of pregnancy before you go, especially in the third trimester, obviously, when those things are more of a risk. You could have a complication either in flight or at your destination. And if that necessitated delivery, it might be in a place you weren't planning on having your baby. So you might not want to get stuck in some other part of the country or some other part of the world while you wait for your baby to be old enough to travel back home. Right now, we definitely recommend against travel to Mexico, the Caribbean, South America, Africa, places like that where there is potential for mosquito-borne infections such as Zika virus. That is still an ongoing concern. There is no sign of that infection really letting up anytime soon. So I really do recommend avoiding those areas if at all possible when you're pregnant, or if you're thinking about getting pregnant in the next several months. Now, a lot of times patients show up having already traveled to one of these places, have now learned that they're pregnant. What should they do? If you've been, say, to Mexico, for example, if you know if you got any mosquito bites or not, did you have a rash and fever or feel ill in any way? If you had any symptoms like that, it is possible it was Zika virus related. It is recommended that you get testing. The CDC right now is recommending that if you traveled to those areas but did not have any symptoms, that testing is not indicated at this point. I would always recommend avoid the areas in the first place. Look at the CDC website before you consider traveling anywhere. There's a worldwide map there. You can pick any particular area and see if there's any concerns or not. The last thing that people often don't think about, it's probably because it's not that big of a deal, is the potential for radiation exposure while you're flying. So obviously when you're in altitude, you are exposed to more radiation than you are down here on the ground, and that's because the atmosphere scatters a lot of that radiation before it hits the ground. The amount of radiation that you receive from flying across the country is less than what you'd get from like a standard chest x-ray. So it's not something you really need to worry about, unless maybe if you work in the airline industry and then you are traveling on a frequent basis, you may be getting more exposure. There are guidelines online where you can calculate what your exposure is based on your travel. So if you're someone who's a frequent traveler, then that may be a concern, but otherwise don't really think it's an issue. Another question that people ask is, what about going through the security line? They use those backscatter machines to search you for weapons or whatever. They're considered safe. It's perfectly fine to go through them as a pregnant person, but it's also equally acceptable just to ask for the pat down. So I hope that these answered most of the commonly asked questions about travel. If you have other questions, feel free to put them in the comments. And thanks for watching, and have a great day.